Overcorrection and undercorrection with fixed dosing of bolus hypertonic saline for symptomatic hyponatremia by Piloto et al. Background: hyponatremia is one of the most common electrolyte disorders in clinical practice. When it develops acutely, it could lead to cerebral edema. Hypertonic saline infusion can effectively raise the plasma sodium concentration and shift water out of the cells. The aim of the study was to assess whether lower and higher body weight are additional risk factors for hyponatremia overcorrection and undercorrection respectively, following fixed dosing of bolus hypertonic saline. This is a retrospective cohort study reviewing records of patients who received an intravenous bolus hypertonic saline for hyponatremia between July 2017 and July 2021. Overcorrection was defined as an increase of more than 10 points in the first 24 hours and or more than 18 points in 48 hours and or the need for relowering therapy. Undercorrection was defined as an increase below 5 points in the first 24 hours. The lowest quartile in body weight was 60 kilos, while the highest quartile was 80 kilos. The rise in plasma sodium was 6.4 millimoles per liter in the first 24 hours and 10.4 millimoles per liter in the first 48 hours. This was inversely correlated with body weight. The overall overcorrection rate was 18%. However, overcorrection occurred significantly more often in patients with low body weight. Low body weight is an independent risk factor for overcorrection. The overall undercorrection rate was 29%. Undercorrection rates in patients with and without high body weight were similar. However, higher body weight of more than 100 kilos was found to be an independent risk factor for undercorrection. Conclusion: a fixed-dose hypertonic saline regimen exposes patients with low and high body weight to more overcorrection and undercorrection. Prospective studies are needed to validate these cutoffs or investigate a weight-based infusion protocol of bolus hypertonic saline. To read the full article, please scan the QR